Welcome back. This is part 2 of Module 4, and in this section, I'll be discussing conditions such as eating disorders and why children in care or those with histories of trauma are at an increased risk for such conditions. Children in foster care or those with histories of trauma often face unique challenges and stressors and suffer from PTSD at far greater rates than those in the general population, which leave them vulnerable to developing eating disorders. Many children in foster care have experienced trauma, neglect, or abuse in their early lives, which can lead to emotional and psychological distress, which some children cope with by turning to food for comfort and security. Some children may have experienced food insecurity before entering foster care, where they didn't have reliable access to enough food, and then this can lead to a fear of scarcity, causing them to overeat when food is available, even if it's in excess. Food can serve as a way to cope with difficult emotions. So children who have been separated from their biological families may use food as a way to soothe their anxiety, sadness, or anger. Disordered eating behaviors such as binge eating and purging may serve as a method of coping and may allow the individuals to dissociate or numb themselves from negative feelings associated with these traumatic memories. Many children in foster care have experienced a loss of control over their lives and environments. So overeating, undereating, or purging can be an attempt to regain a sense of control. In addition, children in foster care may not have received proper nutritional education, which can lead to poor food choices and overconsumption of unhealthy or processed foods. Children with histories of trauma may also be overly attuned to their internal body signals, so they're constantly scanning for signs of threat or danger, or they may be under-attuned and have difficulty identifying hunger and fullness and being able to distinguish that from their other states of bodily needs or emotional arousal, which can lead to eating disorders. Children with histories of trauma are also at an increased risk to develop eating disorders due to body image concerns. They may develop negative body image perceptions, especially if they have faced weight-related issues or criticism from caregivers, peers, or family members. Some children in foster care may also experience social isolation, which makes them vulnerable to negative influences and societal pressure to conform to maybe unrealistic beauty standards, which can lead to disordered eating behaviors. The stress and trauma associated with foster care system can contribute to their anxiety, their depression, and other mental health issues. These conditions can increase the risk of developing eating disorders and is a maladaptive way to cope with their emotional stress. It's important for caregivers to be aware of these risk factors and to provide appropriate support, including psychological counseling and education on healthy eating habits. Early intervention and a nurturing, stable environment can significantly reduce the risk of overeating and eating disorders in children in foster care. If a child in your care presents with symptoms consistent with eating disorders such as anorexia, bulimia, binge eating disorder, or pica-type behaviors, I recommend consulting with your child pediatrician to ensure that your child receives support as early as possible. Specific signs that would indicate the need to see a pediatrician as soon as possible include maybe the observation of a major change in diet or significant weight loss or weight gain. If you notice your child's eating behaviors are significantly impacting their daily functioning, they should also be referred to a mental health professional who can help aid in assessment and appropriate intervention. Eating disorders affect health in many ways and put a nonstop strain on both the brain and the body. Although it's often perceived as non-threatening in children, disordered eating behaviors can pose a significant risk to physical, psychological, and overall well-being. A lack of nutrition can lead to vitamin and mineral deficiencies, hormone loss, and electrolyte imbalances. So overeating versus binge eating. Almost everyone overeats on occasion, such as having seconds or thirds during a holiday meal. But for some people, excessive overeating that feels out of control and becomes a regular occurrence crosses the line into binge eating disorder. Emotional overeating in children, particularly those in foster care, can stem from early life experiences that hinder their ability to distinguish between hunger and fullness and other distressing emotional states. These experiences may include parental food control practices, such as pressuring your child to eat, using food as a source of comfort or reward, or withholding food as punishment. When children who have experienced food neglect or have had food withheld as punishment in their foster care, they may be told that they can eat freely and without restrictions, but in response, they may overeat because they have not developed normal limits on their food consumption, or maybe due to decreased sensations in hunger and fullness. For more information on interoception, see Module 2. It's important to recognize that foster children are often victims of trauma, which can make it challenging for them to regulate their emotions and impulses. In turn, if their food intake is restricted to prevent overeating, they are more likely to overeat, eat too quickly, or binge on food. Oftentimes, restricting food intake can be re-traumatizing and be a trigger for past food experiences. Heightened physical or emotional distress can lead to an increased intake of comfort foods, which are often high in sugar and fat, even when there is no genuine physiological hunger or homeostatic need for food. That's because these types of foods can activate the brain's reward pathway and trigger the release of feel-good neurotransmitters like dopamine, which provides a temporary sense of pleasure and relief from stress. If you are repeatedly using food in response to stress, it becomes an automatic response and decreases an individual's capacity to use other coping strategies. So that's why it's important to introduce new coping strategies and practice repeatedly to overcome eating as an emotional strategy and turn the new strategy into an automatic response. You'll need to practice the new strategy while in a calm and non-stressed state. If you remember from previous modules, when the brain is in survival mode, an individual is unable to rationally think or remember coping strategies. So if this is happening to your child, you may need to participate in coping strategies with them until it becomes an automatic response. While occasional overeating is normal, such as having an extra helping at a meal or eating beyond fullness at a holiday meal, such as Thanksgiving, but if you notice your child consistently overeats, eats in private, eats very quickly, eats until comfortably full, or feels depressed, ashamed, out of control, you may need to speak to your child's pediatrician to see if there's any underlying issues. Binge eating is characterized by consuming large amounts of food in one small sitting and is eaten without attention to hunger or fullness and is not purged afterwards. It is often a coping mechanism to deal with intense emotions and past trauma, something most children in care will experience. Children with histories of abuse and neglect are also at a higher risk due to having unpredictable supplies of food. For young foster children with past trauma, binging can be instinctual if they've previously experienced starvation or had to compete for the food. Just like how animals fear having their food taken away by another pack member, some children may have had to fight with siblings over food in order to be able to eat. Binge eating foods in one go prevents anybody from taking it away. Binge eating is also more common in those with low self-esteem and is a way of initiating self-soothing or diverting attention away from negative emotions. Here are some strategies for overeating. If your child is preoccupied, such as asking when and what the next meal is, or just occasionally overeating, provide reassurance and direction. Provide regular and consistent meals every 2 to 3 hours. Plan your meals ahead of time and create a visual menu board with times and meals so your child can know what to expect. In addition, eat meals together at regular, predictable times. Eating meals together as a family has been linked to healthier child eating patterns and reduces risk of pediatric obesity and provides opportunities to model healthy eating patterns and teach children about nutrition. So sit in the same place with the same utensils and set table rules such as no phones, TV, or toys to limit distractions and create structure and a predictable, safe routine. Allow the child to serve themselves. So provide a portion control plate to help the child gauge how much they should be getting, but allow multiple servings as appropriate. If your child consistently overserves or goes back for multiple servings, it's okay to cut them off. However, reassure them that there will always be food when they need it. It's important to not restrict. You may think it's more logical to restrict the amount of food a child has access to, but restriction tends to lead to further stress. So an anxious, stressed, food-hoarding foster child is likely wanting to eat more and go to more extreme measures to get food. Instead, include all types of food into meals and snacks. So offer sweets or less nutrient-dense foods like chips and fries at mealtime, or offer a serving of dessert at each person's plate with the rest of the meal. But don't use desserts as bribes. Allowing some sweets as part of their weekly snacks and eating small desserts periodically throughout the week helps teach that moderation is a good thing without teaching that there are good and bad foods, but instead there are higher nutrient dense foods that provide us more energy than low nutrient dense foods. I also talked about an anytime bowl in part 1, but this is great for this too. Provide an anytime bowl or a bag of snacks that your child can have access to at any time. And if you fill this with healthy snacks, they're less likely to indulge on that. If you had just finished a meal and your child is asking for snacks, make sure you rule out other types of hunger, such as mouth hunger, hunger in response to the sight or smell of food, emotional hunger, which can be in response to emotional triggers such as stress, anxiety, sadness, loneliness, or even happiness. Also rule out thirst hunger and sleep hunger. If you want to know more about these, see Module 2. I have discussed that more in depth there. Also, try engaging in a stimulating activity like sports or a hobby of some sort. For example, walking the dog, running through the sprinklers, playing a game of badminton, kicking a soccer ball, or even painting a picture. If you're worried your child consistently overeats, eats in private, eats very quickly, eats until uncomfortably full, or feels depressed, ashamed, or out of control, or if you're unsure if your child is just overeating or is binge eating, reach out to your child's pediatrician. Early detection can be instrumental in the recovery and treatment for any individual who is struggling with binge eating disorder. Individuals who've experienced sexual or physical abuse are at an increased risk for developing bulimia. Bulimia is characterized by a cycle of binging and compensatory behaviors such as self-inducing vomiting, using laxatives, diuretics, fasting, or engaging in excessive exercise. There may be fear of weight gain and strict rules about eating, but there may also be series of binge eating followed by purging. In youth who have been in foster care, bulimia was found in 2.9% of this population, which is 7 times higher than the general population. Symptoms of bulimia to look out for include binge eating with no noticeable weight gain, obsession with physical activity, vomiting or laxative abuse. You may also notice bruised or calloused knuckles, bloodshot eyes, if they complain of a frequent sore throat, or if you notice that they make frequent trips to the bathroom following meals, sometimes using running water to hide the sound of their vomiting. If you have any concerns about your child possibly struggling with bulimia, it's important to address these concerns with care and support. I recommend you consult with a healthcare professional or a therapist who specializes in eating disorders. They can provide a proper diagnosis, treatment options, and guidance for your child's recovery. Recognizing the signs of an eating disorder can be distressing, but taking the right steps is necessary for your child's well-being. Create a home environment that promotes a healthy relationship with food and body image, and encourage family meals and open discussions about emotions and struggles. Avoid blaming and shaming your child. Eating disorders are complex and often rooted in emotional issues, so support and understanding are a lot more effective than criticism. Anorexia is characterized by a severe restriction of calories. There may be a fear of weight gain and strict rules about eating, and they may also have binge eating followed by purging. Some of the symptoms of anorexia to look out for include dramatic weight loss or refusal to maintain a body weight that is healthy. They may also be at a healthy weight, but continue to restrict their food. They may wear baggy clothes and layers to hide their body shape. They may exercise excessively or may use diet pills or laxatives to lose weight. You may notice secretive eating patterns or disposing of food in strange places. They may also have hair loss, sunken eyes, pale skin, frequent dizziness and headaches. In severe cases, they may lose their menstrual cycle or have irregular periods. In children with histories of trauma, eating restrictions stem from an adaptive strategy to deal with excessive interoceptive uncertainty or the difficulty in accurately perceiving internal body signals. It goes above and beyond just controlling their body size and weight. By imposing strict rules and limitations on their food intake, individuals may believe that they can gain a sense of control over their body sensations and emotions. The motivation behind these eating restrictions is not solely based on controlling body size or weight. While concerns about body image and weight often play a large role, individuals with impaired interoception, especially individuals with histories of trauma, are often more preoccupied with the need to alleviate emotional discomfort and maintain a sense of predictability and order in their lives. This adaptive strategy can have significant consequences. It can lead to malnutrition, nutritional deficiencies, and unhealthy relationships with food. They can also exacerbate interoceptive uncertainty, as rigid food rules may disconnect individuals from their internal body sensations. Anorexia also comes with physical dangers such as constipation, low heart rate and blood pressure, and maybe abdominal pain. Anorexia can also cause anemia, kidney problems, and changes in brain function. It's important to have your child evaluated if you have any suspicions or concerns about anorexia. The doctor with expertise in eating disorders can provide a comprehensive evaluation, including physical and psychological assessments. They can recommend appropriate treatment options. Early intervention can make a significant difference in a child's recovery, addressing both the physical and emotional aspects of their condition. Pica is characterized by eating things that are not food or eating from unhealthy sources such as the garbage. Eating non-food items can be observed among infants before the ages of 18 to 24 months, but Pica describes the phenomenon of eating non-nutritive substances at an age where it is developmentally inappropriate. Children who've experienced neglect or abuse, such as parent separation or lack of parent-child interaction, may be at an increase of developmental delays, which can contribute to the development of pica. Delayed development can affect the child's understanding of appropriate behaviors and increase their likelihood of engaging in pica. Pica may serve as a way for children to seek sensory stimulation, especially if they've been deprived of sensory experiences or sensory comfort due to neglect. They might be drawn to the taste, texture, or tactile sensations associated with non-food items. The act of consuming non-food items can provide sensory sensations that temporarily alleviate distress. In some cases, children with pica may have witnessed pets or animals eating non-food items and are imitating these actions. Genetic or neurological predispositions may also play a role in the development of pica. Some children may have a genetic disposition that makes them more inclined to engage in this behavior. Children with pica typically exhibit specific patterns of consumption. They may take small bites of non-food items such as toys, paper, plants, rocks, feces, or other objects. They may hold these in their mouths for extended periods before swallowing, or they may swallow occasionally. These behaviors can pose significant health risks, including hepatitis, parasitic infections, anemia, and sometimes intestinal obstruction. It's important that children with pica receive prompt assessment and treatment from their primary care doctor. Early intervention is essential to address the underlying causes of pica and provide appropriate strategies to prevent the child from consuming non-food items. While you're waiting to see a healthcare professional, make sure to address other types of hunger and interoceptive awareness of hunger and fullness. For example, mouth hunger is the desire to chew or eat and is often associated with the need to exercise the jaw or satisfy the sensation of chewing. Chewing can be very calming input for many people. So you can try to provide chewing gum if your child is over 5 years old, or provide crunchy food, or even use non-food items that are made for chewing, such as chewy toys, which can help alleviate this mouth hunger. Teach your child to discriminate between edible and non-edible items and make them aware of the dangers that some substances can present to them. You can also try offering alternative edible food items that have a similar texture to replace the inedible ones. So if they like to eat paper, try giving them rice paper. If they like to eat sand, make edible sand or edible mud. It's also important to remove items in the environment that present a health and safety risk. If you can identify the times that your child is feeling anxious and is more likely to eat non-food items, you can connect with their anxiety, offer them comfort, and support them to use self-soothing strategies. Children in foster care face an increased risk for obesity due to a combination of complex factors. Severe physical, sexual, and emotional abuse in children were associated with greater risks for adult obesity. Traumatic experiences during childhood can lead to various psychological and emotional issues, including the use of food as a coping mechanism. This emotional eating can double the risk of developing obesity later in life, as many individuals may turn to high-calorie comfort foods to deal with their emotional distress. Some factors contributing to obesity include trauma and emotional distress. So, some children in foster care have experienced traumatic events or neglect in their early lives, which can lead to emotional stress and mental health issues. Trauma and emotional stress can trigger unhealthy coping mechanisms, including overeating or emotional eating, and to cope as a way to deal with their feelings. This can contribute to excessive weight gain and the development of obesity. Children in foster care often experience frequent changes in living arrangements, and then this instability in their living conditions can lead to disruptions in daily routines, which makes it more challenging to establish healthy eating and exercise habits. Inconsistent access to nutritious foods and safe environments can also contribute to obesity. Foster children may lack consistent positive role models who can teach them about healthy eating habits and physical activity. Without appropriate guidance, they may be more likely to adopt unhealthy eating patterns and engage in a sedentary lifestyle. The stress of being in foster care, as well as the feelings of abandonment, loss, or rejection, can lead to emotional and psychological issues. These issues may contribute to disordered eating patterns, further increasing the risk for obesity. Obesity not only poses immediate health risks to children, but can also lead to a lifetime of physical and emotional challenges. It can exacerbate existing feelings of low self-esteem, isolation, and body image issues, which may have already been impacted by their past experiences. So it's important to take proactive steps to promote healthier eating habits, physical activity, and emotional well-being as early as possible for children in foster care. That means providing them with nutritious meals, access to safe space for exercise, and emotional support to help them develop a positive relationship with their bodies and understanding the importance of a balanced lifestyle. It's important to promote healthy eating habits and increase physical activity, but it's equally important not to overly restrict their diet. Restricting a child's diet can have unintended consequences, potentially leading to feelings of deprivation, frustration, or even a strained relationship with food. This approach may not only fail to address the root causes of unhealthy eating habits, but could also contribute to emotional distress. So it's important to educate them about balanced nutrition and encourage them to take an active role in decisions around food, which can help them feel a sense of control and develop a positive relationship with food. Children in foster care are at increased risk for malnutrition, growth, and nutritional deficiencies due to several factors, including their prior life experiences, disruptions in their living situations, and challenges associated with the foster care system. Many children in foster care have experienced neglect, abuse, or adverse childhood experiences before entering the foster care system. This may have resulted in chronic malnutrition or food insecurity, impacting their growth and development. Frequent changes in living arrangements, placements in different foster homes or group homes can lead to disruptions in a child's access to regular and nutritious meals. This emotional and behavioral challenges that many children in foster care face, such as stress, anxiety, and coping with past traumas, can affect their appetite and eating habits. Children in foster care may experience food insecurity, which means they do not have consistent access to adequate and reliable food. This can result from inadequate financial resources within the foster family or limited availability of nutritious foods in the community. Foster children may also face barriers to accessing healthcare, including medical, dental, and nutritional support. Regular checkups and assessments that could identify malnutrition may be lacking. Nutritional issues can go undetected if not actively monitored by healthcare professionals. One form of malnutrition common in children in foster care is failure to thrive, which is primarily caused by nutritional deficiencies and neglect, leading to developmental delays and behavioral issues. Children in foster care are particularly susceptible to failure to thrive due to their previous experiences of poverty, limited access to food, or neglect before entering care. Failure to thrive may present as poor weight gain or decrease in height and weight percentiles. Children in foster care are also at a higher risk of anemia, iron deficiency, zinc deficiency, and vitamin A and D insufficiency. as well as insufficient macronutrient consumption from protein and specific fats. These are all super important for both brain and behavior development. When a child enters the foster care system, they require not only a safe and loving environment, but also proper nutrition to help them heal, grow, and develop. Nutritional deficits can impact their cognitive and physical development, as well as their overall health. So it's important that being mindful of the risk of malnutrition in foster children means recognizing their unique needs and ensuring that their dietary requirements are met and offering emotional support. If you have any concerns, if your child is receiving all of the nutrients they need, please consult with their pediatrician. Here are some resources that may be helpful for you. Thanks for following along. If you have a few minutes, I really encourage you to either scan the QR code or go to the main module page. There's a link there that will take you to my survey. Your input as parents is invaluable in guiding the development of my capstone project, and your feedback will play a significant role in enhancing this education program. So I'd appreciate it if you took a few minutes to complete the survey. Thanks again for watching. I hope you found some of the information useful. You can also check out modules 1, 2, and 3 for more information.